My name is Olga Castrillo, and my presentation is about Oppositional Defiant Disorder, ODD. Oppositional Defiant Disorder, ODD, is a behavior condition in which your child displays a continuing pattern of uncooperative, defiant, and sometimes hostile behavior toward people in authority. The majority of children and teens who have ODD also have at least one other mental health condition, including attention deficit hyperactivity disorder, ADHD, anxiety disorders, including obsessive compulsive disorder, OCD, learning differences, mood disorders such as depression, impulse control disorders. Who does oppositional defiant disorder affect? ODD most commonly affects children and teenagers, but it can also affect adults. It most commonly begins by age 8. Some children outgrow ODD or receive proper treatment for it, while others continue to have symptoms through adulthood. Your child is more likely to develop ODD if they have the following risk factors: a history of child abuse or neglect, a parent or caregiver who has a mood disorder or who has substance or alcohol use disorders, exposure to violence, inconsistent discipline and lack of adult supervision, financial problems in their family, instability in their family, such as divorce, moving to different houses often, and changing schools frequently. Parents who have or have had ODD, attention deficit hyperactivity disorder, ADHD, or behavioral problems. How common is ODD? Researchers estimate that oppositional defiant disorder affects 2% to 11% of children. This range is so wide because some children may be misdiagnosed as having conduct disorder, and teenagers as a population are often underdiagnosed. Signs and symptoms of ODD can be grouped into 3 categories: anger and irritability, argumentative and defiant behavior, vindictiveness. What causes oppositional defiant disorder? Genetic factors. Many children and teens with ODD have close family members with mental health conditions, including mood disorders, anxiety disorders, and personality disorders. Biological factors. OD has been linked to issues with certain neurotransmitters, which help nerve cells in your brain communicate with each other. Environmental factors. Having a chaotic family life, childhood maltreatment, and inconsistent parenting can all contribute to the development of ODD. How is OD treated in a child? Early treatment can often prevent future problems. Treatment will depend on your child's symptoms, age, and health. It will also depend on how bad the ODD is. Treatment may include cognitive behavioral therapy, family therapy, peer group therapy, medicines. Important information for use in an emergency situation. When working with a student who has oppositional defiant disorder, ODD, an educational assistant, EA, should be prepared to handle emergencies with a focus on de-escalation and safety. Here are some steps an EA can take in case of an emergency involving a student with ODD. Stay calm. Your calmness can help to reduce the anxiety and agitation of the student. Assess the situation. Determine the immediate needs of the student and ensure their safety as well as the safety of other students. Assess whether the behavior poses a risk to themselves or others. Use de-escalation techniques. Utilize strategies such as active listening, validation of feelings, and discussing alternative ways to express frustration or anger. Create space. Sometimes students with ODD may need some space to calm down. If it's safe to do so, allow the student to step away from the situation to cool off. Use positive reinforcement. If the student responds positively during the situation, acknowledge their efforts. Positive feedback can encourage better behavior in the future. Monitor safety. Ensure that both the student and others in the environment are safe. If the situation escalates to potential harm to the student or others, it may be necessary to activate crisis protocols or involve additional staff, such as a behavior specialist or administrator. Follow behavior plans. If the student has an individualized education plan, IEP, or a behavior intervention plan, refer to it for specific strategies tailored to their needs. Document the incident. After the situation has calmed down, document what happened for future reference. This can help in adjusting strategies and interventions for the student moving forward. Communicate with staff and parents. Share details about the incident with relevant staff members, such as the classroom teacher, school counselor, or administration, and let them know if any follow-up is needed. It may also be important to communicate with the student's parents. Reflect and plan. After the incident, reflect on what occurred to improve future responses. Consider ways to modify the environment or approach to prevent similar situations. Classroom strategies to support the ODD students academically and socially. Supporting students with oppositional defiant disorder, OD, academically and socially requires a multifaceted approach that encompasses positive behavioral strategies, structured environments, and tailored instructional methods. Here are some effective classroom strategies. Structured routines. Establish clear and consistent daily routines to provide stability and predictability. Use visual schedules to help students know what to expect. Break tasks into manageable steps. Break assignments into smaller, achievable tasks to prevent overwhelming students. Provide clear, concise instructions. Frequent check-ins. Schedule regular check-ins to monitor progress and provide feedback. This can help students stay focused and feel supported. Modify assignments. Adjust the level of difficulty, length, or format of assignments based on individual needs. Offer choices in how they can complete tasks. Incorporate interests. Connect academic content to the students' interests and strengths to engage them more effectively. Use visual aids and interactive activities. Incorporate visual supports, hands-on activities, and technology to maintain interest and provide alternative ways to engage with the material. Social support strategies. Social skills training. Provide explicit instruction on social skills such as communication, conflict resolution, and cooperative play. Use role-playing scenarios to practice these skills. Peer buddy system. Pair ODD students with supportive peers who can model appropriate behaviors and provide social reinforcement. Create a safe classroom environment. Foster a classroom culture of respect and understanding. Encourage students to express their feelings and challenges without fear of judgment. Teach self-regulation strategies. Help students identify their emotions and teach coping strategies. Example, deep breathing exercises, taking a break to manage frustration or anger. Involvement in group work. Encourage participation in group activities that require collaboration. Provide clear roles so every student has a purpose in the group dynamic. Focus on strengths. Highlight and celebrate the individual strengths of ODD students. Use these strengths as a foundation for building relationships and enhancing self-esteem. Model appropriate behaviors. Demonstrate positive behaviors and responses in various situations. Explicitly discuss the reasons behind these behaviors. Specific communication strategies. Supporting children with oppositional defiant disorder, ODD, requires specific communication strategies that foster positive interactions and reduce conflict. Key strategies for educational assistance include building trust. Use consistent language and engage in positive interactions to establish rapport. Clarity in communication. Provide direct, simple instructions and specify expected behaviors to avoid confusion. Active listening. Acknowledge and reflect on the child's feelings to ensure they feel understood. Positive reinforcement. Offer praise for good behavior and implement reward systems for achieving behavioral goals. Empathy. Validate the child's feelings and encourage expressions of their emotions in constructive ways. Non-threatening body language. Use open body language and adopt a child-friendly position to foster approachability. Structure and routine. Provide a consistent schedule to help reduce anxiety and prepare the child for transitions. Involve parents. Communicate regularly with parents about the child's progress and collaborate on behavior management strategies. Creating a personal care plan for a child with oppositional defiant disorder, ODD, involves addressing their specific challenges while promoting positive behaviors, emotional regulation, and social skills. The plan should be personalized and developed collaboratively with parents, teachers, mental health professionals, and the child. Assessment. Gather insights from parents, teachers, and caregivers to understand the child's strengths and challenges. Goals and objectives. Set specific, measurable short-term goals for immediate improvement and long-term goals for enhancing social skills and emotional regulation. Behavior management strategies. Establish a structured daily routine. Use positive reinforcement for good behavior. Set clear consequences for misbehavior and model effective communication. Coping strategies. Teach techniques for emotional regulation and problem solving while engaging the child in social skill building activities. Therapeutic support. Include individual and family therapy, as well as group sessions, to improve coping strategies and social skills. School collaboration. Partner with schools to create an individualized education plan, IEP, or a 504 plan, ensuring consistent communication between home and school. Parental support and training. Encourage participation in workshops and support groups for parents to enhance their management strategies. Monitoring and review. Regularly assess the child's progress and adjust the plan as needed. Crisis management plan. Help the child identify triggers and develop strategies for calming down during overwhelming situations. Thank you very much for your attention.